Really excited to have everyone join us. I'm Britt Gould, VP of Product Marketing at Echo. And by way of brief introduction, so we can dive right into this, we're excited to have a set of experts here with us to discuss telehealth funding opportunities. We'll do deep introductions with them in here just a moment. Really quickly, since we haven't had a chance to meet all of you, if you happen to be wondering, so why is Echo presenting and why did Echo put together a webinar on telehealth? So a little bit briefly about what we do, not to try and promote anything, but just to give it context. We enable more comprehensive telehealth examinations by providing the physiological information missing in most virtual care settings. How does that work? Well, it's a combination of digital stethoscopes that provide great sound quality and let you perform that auscultation with telehealth remotely. So it's all to help make confident care decisions in virtual visits. Providers need to have that information from patients that a single video feed like what we're doing here, and unfortunately we saw with Devin's internet connection there, can be a challenge. So adding that information can significantly help providers when they're performing a visit remotely. I'll leave it at that for now so that we can get into it. Certainly to learn more, to see the experience for yourself, learn more, listen to it, do visit echohealth.com. With that, let's dive right into some introductions. We are very pleased to be joined by a panel of speakers who are experts in the field. Starting with Kristin Deprospero. She's Vertical Market Director for Telemedicine and Distance Learning at Solutionz, as well as a Board of Directors member of the the United States Distance Learning Association, CEO of Funding Solutions Corp, and active in LinkedIn. She'll share a personal story with us in just a few minutes. She has been in distance learning and telemedicine since 1988, longer than certainly most of us have been doing telemedicine or distance learning, even for that matter. We've got Pat Cassella. He's president of ETCVideo, and long list of things here. He's been a distance learning and telehealth consultant and grant writer, past president of the United States Distance Learning Association. Lots of experience in the space, including grants and grant writing. I learned as we were putting this together that he's also a nationally certified motorcycle instructor. Nice to have a variety of experience. And our third special guest, who we had the pleasure of adding more recently, another expert in the field, Kathleen Harrell. Kathleen is partner at Salient Health Solutions and Barrett and Harrell Health Law. She, as a regulatory attorney specializing in federal and state bid solicitations, she's been working on grants and grant funding for the past 15 years, more than 20 years, and helping her clients obtain a significant amount of grants to help them out. So thrilled to turn it over to our speakers and panelists this morning and this afternoon. And with that, Kristin and the whole team, I'll turn it over to you.
Right, great. You got to know who we are. We thought it would be useful to get to know who's participating and who you are. So you'll look for that poll as it pops up. One of the things you want to do is just click which of the following organizations best describes you. And while you guys are doing this, I'm going to talk for just a minute about a personal story about telehealth and telemedicine that is my own story. I think it's very interesting. I found out through participation at the American Telemedicine Association conference in 2001, while talking to a doctor. She said, "You have Duane syndrome." And I said, "Who's Duane? I don't know anything about that." It is a neurological disorder of the eyes. A couple of years later, I found out through another telemedicine consult talking about business in my career that I have something called spasmodic dysphonia, which is a neurological disorder of the vocal cords. So you can hear it, it acts up, it gets a little crazy. So it's just fascinating to me that through telehealth, through telemedicine, um, I've been able to navigate some of my own personal health situation and understand things better than I think I ever would had I not been involved in this career or this business. So I think it's pretty interesting. So we have 81% of the votes in, 124 people out of 151. You all can probably see this. We have a lot of people from health systems, a lot of physicians practice in private clinics, some systems integrators and others, and we do have some educational institutions. So good. I think that the information that we're going to share is going to be relevant to everyone. We did have a few questions in the chat about whether or not this was funding that would work for international locations. It is not. So we apologize, but this funding is limited to the United States and United States territories. So with that, if you would like, I could hand it over to Kathleen. The first funding source that we're going to talk about is from the FCC, who we have seen a lot of funding coming from over the past few years, but particularly more and more funding once COVID became a reality. So Kathleen, I'll turn it over to you, and I believe that I will have the option to forward the slides. So these are the funding sources we're going to talk about. Uh, and we're going to start with the FCC. So Kathleen, if you want to start, I will get that pushed over there.
Sounds good. So the first opportunity we're going to talk about is the second round of FCC COVID-19 telehealth grant funding. This funding is going to be available for U.S. states and U.S. territories for healthcare providers in those geographic areas. And last year, you may be familiar that there was about $200 million that was available in the first round of this funding. That funding, again, for healthcare providers, it was for devices and different forms of technology to carry out telemedicine during the COVID-19 pandemic. This new round is going to look a little bit different than that first round. And we have some intelligence about what it's going to look like, but we do not have the actual application yet. We believe that will be coming out in the next week or two, but excited to share some mechanisms that and some other activities that you can do to be prepared for when it does come out. So this time around, there's going to be about $250 million that will be available for healthcare providers. The FCC, as I mentioned, established this program last April to equip healthcare providers during the pandemic. We believe the mission of the program will continue. You will be allowed to apply for devices and different forms of technology to carry out telemedicine. Most importantly, we do not believe that the program is changing to allow administrative, staffing, or other types of overhead costs, although that may be something that's coming and we don't know about it. But for now, I would plan just on thinking about what your technology costs are and also, what those device costs would look like. In the next slide, we'll talk a little bit about some of the parameters we know are going to be part of this second round. So we've gotten the question quite frequently, if I was able to apply and win in the first round, will I be able to get money in the second round? The one thing we know about that piece is that there's going to be a priority system put in place. I'm not sure if that will be additional points, which is generally the case in federal grants for certain types of providers that are from the hardest hit areas or low income areas, but there will definitely be some type of priority system for those two things. Those areas that were hit hardest by COVID-19 and those areas that have large populations of low income individuals. They also want this time around to be an equitable distribution of funding. So all 50 states, plus US territories, plus the District of Columbia would receive money. I believe in the last round, only 47 states received funding, as well as some of the US territories. The biggest difference is the process by which we're going to go through this grant this time. So the last round had people sort of scrambling, putting in materials very quickly. That was because grants were reviewed on a rolling deadline. So the faster you got your grant in, the more likely you were going to be able to obtain funding. This time around, it's going to run as a competitive grant process. So there will be a set deadline by which you have to apply. There will be some type of grant funding opportunity announcement that will be issued that will have all the details for the application, plus I'm sure information sessions. And again, those are coming, so we can make sure everybody on the mailing list has access when the application does come out. And then also, this time around, the FCC is going to do funding in 2 phases. The first phase, it sounds like, is for providers who need to implement immediately certain types of technology to carry out telemedicine. And then there'll be a second phase, which will allow people who are either applying for secondary monies, or they have projects that are more long-term and don't need those expedited dollars to be able to carry out telemedicine, you know, for the remainder of the pandemic and then post-pandemic. And then on the next slide, we just go through a couple of the things that you can do as an organization to ready yourself for when the application comes out. Again, we don't know the whole process, what it looks like. We do know it's a competitive grant application, but these are things that had to be done in the first round of grants. So we want to make sure people at least do these things to get set up. You want to register with the FCC registration system CORS, and in that way you can get an FCC registration number, which is called an FRN. You have to have an FRN typically to receive any form of FCC money. If you've received Connected Care pilot dollars, any other types of rural funding from the FCC, you probably already have one of those in place, but you should double check and make sure it is still sound and up to date. You'll also want to register with USAC, or the Universal Service Administration Company. The way you do that is by completing a Form 460. You literally can Google FCC Form 460. Up will come the actual form as well as a set of instructions, and you can register your organization with USAC. One side note, if you are a consortium, every single one of the entities within your consortium needs to register. So they need to register through USAC, and then there'll be a legal process by which you give them authority over your organization to apply as a consortium, but everybody has to be registered. And the reason I say this so emphatically is because a lot of folks lost out last time as consortiums because only the lead was registered and they didn't have all those other entities registered. I work with one client that has 35 health centers under them. All health centers were registered, but the consortium was the actual applicant. And then the other things just to be thinking about as you're thinking through, what can I apply for? What do I want to apply for? When you're thinking about those devices and technology, you do have to have supporting documentation. So in the first round of the COVID-19 funding, people, hospitals, health centers, all kinds of rural providers, and other providers were scrambling to get quotes and get information on certain types of devices. If you know that you're going to be seeking a certain type of technology and device, reach out to Kristin or one of the other vendors that you work with, and make sure you have supporting documentation. You will not be funded without it. And even, if it's not at the forefront of all the criteria, I'm sure it will be one of the criteria that's listed, and it's just a best practice to have those pieces to go in for the grant so you have it for your own records. So that's basically the second round of FCC in a nutshell, and I'll turn it over.
Thanks, Kathleen. Hey, just a quick question. We're going to have Q&A at the end, but I noticed that we had a question in here that says, will we need to submit the RHC Form 460 again? And will these be reviewed more quickly than the last round? So if you already have one in, do you have to register again?
No, you do not have to register again. You just want to make sure your information is current. So I would just go back in and make sure that information's current. And also your USAC information does expire. You usually receive a number of emails telling you you're about to expire, but I would definitely go back in and make sure that's taken care of. And one important thing to note, we don't know how this grant will look in terms of process, but most grants go through the grants.gov and sam.gov systems, which I know Pat is going to speak about in a little bit. And just making sure, after this presentation, if you have questions about registration, please reach out to one of us. We're happy to help you if it's your first time. And it is so imperative that you get registered and do not wait before an application comes out. As Pat will tell you, sam.gov can take a few weeks to get approved, sometimes 8 weeks if there's a backlog. So it's very important you get those pieces in place so that you can actually be eligible for the funding.
And just a note, all of our contact information is going to be at the end of this presentation. Everybody's going to receive this presentation, so you'll be able to refer back to us if you have additional questions. But again, Pat is going to talk about this too, but it's important with all of these systems, whether it's USAC or grants.gov or sam.gov, that you're getting yourself registered. I see a couple people asking questions. What if it's your first time? I highly recommend that you work with one of the experts we have here on this call, called one of the three of us. We can refer you to others. We can help give you the to-do list, the checklist of what you have to do to get yourself in the game and in the process to potentially win these funds. Okay, so I'm going to cover the second funding source that is so relevant to telehealth, and that's the one from the U.S. Department of Agriculture, Rural Utility Services. A lot of people call it the RUS grant because it's in the Rural Utility Services program. It's also referred to as the DLT program, Distance Learning and Telemedicine. Just know that it's got those couple of different names. It's been around since 1994. This little cover page that you see here is from a webinar that Kathleen and I did with Shekinah Pepper, who is the field chief, branch chief director. He's got a long title for the field staff. Fabulous person. These guys like to answer questions for customers, and we did a presentation on the 12th that is recorded, and you can contact us to get that as well. But we will go over some of the basics of this grant. And this one also is about to come out. So both the FCC and this USDA grant are both hitting the street at any moment. And so you really need to be thinking about this, dedicate time on your calendars to promote your content and figure out what you're going to request and get your quotes. There's a lot of things to do to prepare, and the time is now. So the major program details about this USDA Rural Utility Services grant, which I'm just going to call the RUS grant from now on, is that it is a capital grant. It's for equipment, software, and broadband facilities. This one's a little rare because there's so many grants out there that will pay salaries and soft costs, but this one is all about capital expenses. So keep that in mind. It's also a 3-year grant that will cover shipping, installation, maintenance, and training on all of the equipment that you purchase. And the equipment can be video conferencing equipment, it can be digital stethoscopes, it can be ECG systems, it could be anything that you need to do a real-time consult with in your telemedicine practice. Or if you're talking distance learning, I saw a couple of education institutions that might be teaching about healthcare applications. This applies to you as well. If you have video conferencing, cameras, microphones, speakers, computers, there's all sorts of things that are eligible. It's up to $1 million award, or at least it was last year. And last year was also the first year that they had 2 application windows. Prior to last year, it was a $500,000 maximum grant award amount. We don't know for sure in this round that's going to be released if it's going to be $1 million or 500,000. I keep my fingers crossed that it's $1 million, but this doesn't really do a lot until we see the release. The real key to this program is that it's rural focused. The whole point is to increase access to education and healthcare in rural America, rural areas in the United States and United States territories. Urban providers can participate by delivering services out to those rural locations. So don't think that you can't be a part of this. In fact, you could be the lead applicant who's pulling in your rural locations that you want to provide services to. But it has to be real-time collaborative activities. And who's eligible? Pretty much everyone. This part's easy. The only people that aren't eligible are individuals. You can be for-profit organizations and you are eligible. It's a 3-year grant, as I talked about. It also covers warranty and full support on that equipment. And there's a 15% match. So it's essentially an 85% discount on everything that you're purchasing. And the scoring is both objective and subjective. And so the scoring is in some ways pretty easy because the majority of the score is very objective. It either is or it isn't. You either are exceptionally rural and you have 5,000 or fewer in the population of the city where the equipment is going to reside. There are different levels. 5,000 or fewer gets the maximum points. It can go then to 10,000 and 20,000, etc. But you really want to try to reach those exceptionally rural areas that are in high need areas. Hubs can have higher populations. Those can be urban, and the population, it's 100,000, 1 million, it doesn't matter. It's not counted in the scoring. So keep that in mind. Economic need is a big factor. So areas that have been economically hit very hard or that historically have issues is something that you really want to focus on because those are going to be prime focuses as winners for this grant. Other special consideration points could increase scores. It might be opportunity zones. It might be places that are highly hit with the opioid and substance use disorders and that crisis. There could possibly be a focus on tribal again this year, but until the FOA comes out and we see the funding opportunity announcement, we can't give you the special consideration point information. We're just telling you these are some of those that have been in the past. Now the subjective score, this is where you really have to make the reviewer cry. You have to talk about the needs and benefits. If you implement this program, you're going to raise this population up either economically or for education or provide healthcare that they simply don't have access to. And that's so critical because there really literally are areas of the country where people have such high rates of diabetes or high rates of other types of disorders and issues, and they just don't have access to specialists. They don't have access to providers. So this is why the USDA offers this. You also want to make sure that you have local community involvement and partners. So the proposal needs to really discuss how are all of those partners and your technology really going to help to solve the challenges or the problems of that community. So Pat, myself, Kathleen, we've had decades of experience really focusing on this needs and benefits section. It's very important. Also, application components, it's a very technical grant. It requires a ton of detail. So I'm going to highly recommend that you use an experienced grant writer. It's important to follow the checklist of activities, and something she kind of said on our previous call, how frustrated they were in Washington that people would take the checklist that's in the grant application and simply check it and sign it and submit it because it was required, but they hadn't done everything on the checklist, which is, you know, interesting and very frustrating to Washington because they just couldn't, you technically didn't make it through the review because you didn't supply what was requested. So, but again, I talk about making the reviewer cry because you want your narratives to really be well thought out and talk about how it's going to make an impact in so many different ways. And it may not be a direct impact. You may be able to talk about how technology is going to help provide education to this community that could help students develop a career in healthcare that would help to enhance access to services in the local community to combat a heavy population of diabetes. So you really have to think through all of the possible connections and take it as far as you can in terms of how it can impact the community. Now, the worksheets, some of the technical pieces of the application, you want to have your site addresses. You definitely need to confirm that SAM.gov and grants.gov registration. Pat's going to repeat that again. Your budget development, it takes time. So you really need to start now. Talking with your vendors, feel free to call me, feel free to call Pat, Kathleen, and we can help you understand what's required for this section. And you want to make sure you ask for what you need, but also shoot for the moon. I mean, they even tell us this from the USDA. Shoot for the moon, you know, shoot for the things that are innovative and larger displays and things that you might need. Don't go small, go big. If they don't like it, if they don't think you need that much, they'll redline it. You can't ask for more, but you can always implement the grant at a lower budget. So don't get stuck 6-8 months from now thinking, oh, we should have asked for more things. Go ahead and do that now. Put it in there. Think a year, 2 years, 3 years. This is a long-term grant. And then you need to identify your match sources. Where are you going to get that 15%? You've got to know that up front. You've got to be very clear on that. If you have to have board approval, start thinking about that. Board approval to apply, board approval to identify and secure that match, all of those things. So having experts help you, like ourselves on this call, makes such a big difference. We have a near 100% success rate, the three of us, in getting applications successfully through the process and have applicants win. So keep that in mind. If you do this yourself, there are just too many gotchas, too many ways to potentially make a mistake. Now, we talked about the FCC, we talked about the RUS grant, but there is more funding out there than ever before in history, from federal, state, foundation, local funds. I provided this quick little view from ETCVideo, a tool that allows you to search for specific funding. Capital impact, community development block grants, tribal broadband. There's so much funding out there. Again, if you need guidance on something that doesn't fit for the FCC or for the USDA grant, there are so many more to look for. This last slide that I am putting up here comes to us from Stuart Ferguson. Some of you may know him. He is quite famous in the industry. He deployed and designed the whole telemedicine system throughout the state of Alaska that had to do telemedicine way before the rest of us did in the lower 48 or even in the entire world, because Alaska had so many remote locations that needed education and healthcare. And he talks about the evolution of telehealth being just one component of digital health. So the types of things that are included, the types of patient to provider activities, the telehealth modalities, and the provider to provider activities. So I wanted to include this. His presentations are just fascinating. I picked just one slide to put in here, but hopefully we can bring more of this to you through additional webinars. Now, lastly, before I hand it over to Pat, let me tell you that the resources you have available to find these funding sources are phenomenal. you have a lot of options. One of those is the telehealth resource centers across the country. These are dedicated to helping organizations who are trying to implement or expand telemedicine. And then you've got HRSA, you've got FCC.gov, you've got OAT, the Office for the Advancement of Telehealth, of course, grants.gov, where we're telling you need to register and you can search for grants there. We have our friends at Learn, Design, Apply that are very experienced, and they help with grant writing and design of your application. So there are a lot of people. Grants Office is an excellent resource. eCivis helps you search for those funding sources. And last, I'm going to point you to the Rural Health Information Hub, our HI Hub. They currently show 24 active opportunities or open grants that have the word telehealth or are about telehealth, and 67 inactive grants, meaning that those same grants may come open again and be active very soon in the future. So keep in mind, these resources are here. They're going to have the hyperlinks. So when you get this document, you'll be able to hyperlink to any of these locations. And with that, I'm going to pass it over to Pat to talk about how do you make sure you submit a successful application.
Nice job, Kristin and Kathleen. Great information for everyone. Good afternoon, good morning, might even be good evening. Hope everybody's doing well. So I'm gonna shadow what Kristin just went over on the RUS DLT side of things. You know, if you do a RUS DLT grant and you can get through it, you can pretty much do almost any grant. There's a lot of information in here, okay? So we use this as a framework. One of the first things, and both Kathleen and Kristin said it, SAMS and grants.gov. Make sure your account is active. You're going to see on my slides a little red highlight on each of my slides for one bullet point. That's the one to pay attention to. Make sure your SAMS registration is active. I can't tell you how many times you're in the last week of reviewing a grant and folks go to log in and, oh, that person left the company. Oh, my login doesn't work. Oh. And I will tell you,
know, Pat, I'll tell you, we had a weird experience where there were school districts that had the same name and they thought they were registered, but they weren't. So just really, really focus on this. It's super important.
First thing, it's so easy to do, but do it early on. And I will tell you that their timeline is not tied to your timeline, right? So just because you have to get your grant in tomorrow, they could care less. They're not going to jump through hoops for you. So your form here, one of the first forms is a 424, an SF 424. And this is where you want to go and gather a bunch of information that you're going to need to apply for the grant. You've got to make sure that you have your EIN number, your 501c3 status, your DUNS. Make sure you know your legal name and address. It's going to ask you for the federal agency's name of the grant that you're applying to. It's going to ask you for a funding opportunity number. There are going to be site worksheets involved, sites. Kristin touched on this, Kathleen, as well. You're going to have, in this case, a hub site, an end user site. Make sure you have all your sites kind of on board, you know, what you're thinking about with, especially on this one, rurality, okay? You know, your hub site doesn't have to be rural, but your end user sites, you're going to be in a competitive situation. Go for the most rural areas that you possibly can go for, because that 5,000 population is going to get more points than one with 10,000, 15, or 20,000, okay? Legal existence sounds simple. I mean, you just need to prove I'm a legal entity, right? How hard could that be? Well, just make sure that you have your documentation that you can prove it, all right? It could be bylaws, a state law that gives you the permission to be an educational entity, charter to operate your business. You want to have some kind of an authority to contract with the United States government to do business, to get a grant. So, and even in some situations where it was murky, we've gone as far as getting legal counsel and get a legal letter saying, hey, you know, this entity is able to do business with the US government and here's why. Okay, so don't get caught with this just thinking it's a check. Oh yeah, I've got some papers that show it. You really want to make sure that you're legitimate to go ahead and do this. Executive summary, it's a great place to start and it's a great place to end. And your executive summary when you start and when you end, it might not look the same, okay? I'll tell you that. But you know, it's really good. Just say, hey, a quick abstract, couple of paragraphs, be concise, but be complete. Why is this project needed? Okay, what is my community? What am I going to be doing? You know, back to that needs and benefits that Kristin was talking about. You know, my community is in desperate need of having some remote telehealth services because there's no good doctors in my area. Okay, that's a big need. Well, how are you going to go and accomplish this with the project? What are you going to do? What kind of benefits are you going to bring to the community? So, you know, what's broken and how will you fix it if you get the funds for this particular grant? Okay, just really simple. You know, why is this project needed? Economic need. We were talking before, Kristin had a slide up, objective and subjective scores. Objective are what they are. There's a grading system, you're going to fall in no matter what. There's not much ambiguity there. And this is one that's an objective score. It's basically a reflection of your economy. In the old days, they used to use National School Lunch Program numbers, NSLP numbers. Now they're using the safety numbers. I gave you a link there. You'll go back, you're going to look up your community, you're going to look up your individual areas, and it's just going to show a snapshot of your economic need, right? What shape is your community in? And you're going to have to include this information with your grant, right? That's going to be part of it. So there's a validation and verification process. It's not just, you know, you're going to make these numbers up or you saw them in an article somewhere. You're going to have legitimate approved data to do this. And this is the site that you're going to go and look at here. Matching funds, okay? As Kristin pointed out, with this particular RUS DLT grant, there is a minimum of 15%. Grants are all different, but in this particular case, they're going to have at least some level of matching funds, meaning you're putting some skin in the game. What are you going to provide? Again, this one is, why do I have subjective up there? This is an objective one. I have to cross that one out. Must have been thinking subjective on my mind. This is objective. Okay.
Yeah, and Pat, I don't remember if we mentioned this, Kathleen, the FCC has no match, right? No match. So different grants have different requirements. Zero match on the FCC. This one has 15%. We will be able to help you with any grant that you're looking at to understand what is your requirement from this perspective.
That's right. So here's a little secret on this one, okay? You know, you're getting ready to go and purchase some laptops that you were going to go and buy anyhow, regardless, okay? But they're going to be part of your project. They're part of your distance learning, your telehealth project. Well, guess what? You can leverage those funds towards your matching percentage. Little asterisk, you have to make sure that you don't buy any of that equipment until after you file your application. Can't be the day before. Can't be a month before, has to be after you file your application. As long as you do that, you're going to be able to apply that money. So if you go and somebody says, geez, I don't have any money to spend, go look in your technology budget. You probably have some money to spend in there. And if you can apply it towards this DLT grant, that will get you into the running for a cash match. Again, this being objective, you get more money for the more money you're putting into it. So the more you can find, the better your grant application is going to be, the stronger it's going to be. And if you do get a letter saying, hey, I'm a participating school, I'm going to take a certain amount, or participating health facility, and I'm going to put a certain amount of money towards this project, make sure it's a signed matching letter. Got to have a signature on it, okay? Needs and benefits. Kristin said, make them cry. I mean, it's true. You're going to have to paint your picture of the economy. And there's a lot of different ways. Make sure you do a lot of research. All right. There's a lot of articles you're going to be able to reference and whatnot. But, you know, the ones that are in the worst shape are going to be in better shape to get money from this grant. Okay. It is another one where we switch gears from objective. Now you're subjective. There's not a nice little chart that the reviewer looks at and gives you a rating. And I hate to say it, one reviewer, you might be tugging on their heart a little bit different than a different reviewer. So just try to be as strong as possible with your case. How does this project help the community? Okay. That's
Yeah,
really,
and I
really,
always say that grants don't pay for technology, they pay to solve a problem. So
that's
just
right.
be super clear on your problem. And we're getting close to doing Q&A, but you've got a couple more slides.
Yeah, I'll finish it. So scope of work. In this case, here's my note in red. Think like a project manager. Who's going to do what? In what time frame? When do they have to get it done by? Think about, you're putting together a project schedule. You're going to assign people tasks. That's what they're looking for. And this is where you're going to get into your budget a little bit. And you're going to talk a little bit about innovation. And that's where a good grant writer can help. It's a competitive area. And you want to show that you're being more innovative than the others. It's not like the old days where you say, I'm going to use high definition video equipment. Everybody uses high definition video equipment now. It's not good enough anymore. All right. So as time goes on, so do those requirements. Sustainability and your experience, statement of experience. Have you done this before? Sometimes you might just say, no, we've never done it before. But you know something, the guy at the grants office said, that's okay. You can put that in there. It's fine. This is, again, a little bit of a checklist here, but you want to be able to show that once the money's gone in 3 years, how are you going to sustain the project, right? Maybe the offices, maybe the little rural health facilities, you're going to charge a $15 fee or something like that. There's something that you're going to bring in some level of income that's going to help maintain the equipment that you just went and requested through the grant, okay? Telecommunications plan, Kristin touched on this too. This is where it gets a little technical. You are going to describe every line item, and in red, I am saying this. Describe in detail every line item of the piece of equipment, what it will be used for. Your reviewers are not technical people. They're not in telehealth. They're not in distance learning. They need to be spoon-fed the information, just like you're writing it to somebody who's never seen this for the first time.
And I have to give you an unbelievable example, Pat. I don't think there's a person on the planet who hasn't heard the name Zoom in the last year, but I had a reviewer come back and ask, what is the purpose for the Zoom licenses and what does Zoom do? So even if they knew what it was, they want to know that the instructions and details are incredibly spelled out. So that'll show you how detailed you need to be.
That's right. Very technical. You're going to have your maps of coverage, et cetera. Other considerations. What are some other things to think about? Your time invested in a grant, regardless of the grant, that is going to be an exact correlation to how successful your chances are in getting that grant. I will tell you that. Go with a good grant writer if you can, somebody with experience, because that's also going to be important. They'll keep you from falling into the traps.
Absolutely. Now, I know, Brett, you're coming back on. I see a whole bunch of questions in here we can start with. Do you want to cover how this is going to go in the office hours?
Sure, let's do that. Thank you so much, Kristin, Kathleen, Pat. This has been really, really informational and very helpful. To our audience, if you have questions that we haven't answered yet or that our team has not answered yet, put them into the Q&A. That way we're sure to see them. I saw a number of them in chat. We may not have gotten to them. Drop them into Q&A. Thanks for bearing with us with the process. That way we'll make sure that we catch them. Kristin and Pat have been very gracious to add some time on their calendars tomorrow and Monday for office hours. I just put into the chat a link. If you're interested in a 20-minute slot with one of them, go ahead and click on that link and reserve a spot on Friday or Monday. At the end of this, we will share contact information for Kristin, for Pat, for Kathleen. It'll be at the end of the presentation. We will also email it out by tonight. So just look for that. With that, Kristin, let's jump right into Q&A. Feel free to take them and I can ask them as we go.
Yeah, there's a couple that I want to go ahead and hit right away because we had some people asking, what does it cost to have experts, grant writers, grant consultants to help you on these grants? Kathleen and Pat, do you want to share sort of what you see as the average?
Sure. Yeah, go ahead, Kathleen.
Sure. So I would say, for FCC grants, they are not as detailed, although There can be a lot of detail you have to provide depending on how large your request is. So those are usually, at least from what I've seen, around $5,000 or so. And then because the distance learning and telemedicine grants are so much more involved, those can be anywhere from $8,500 to $10,000, sometimes a little over that, just depending upon how many sites you have. Sometimes we literally have 50 sites and you're coordinating with all of that information. So it's just a matter of how large the scope of the work is. I don't know,
Exactly.
Pat, if you've seen others.
No, right on, right on. Yep.
So I lost the Q&A. Let me go to the Q&A. I had it up. Here it is. Okay. So let me go down here. Someone asked, can this be used to develop new telemedicine app or only for integration? I don't believe this can be used to actually develop a new app. What do you guys think? Either FCC or USDA. There may be other programs, and we could potentially do some research to help you find those. But as of right now, and I believe there's got to be a lot of investors, private investors, people that are looking to do that. But these programs are not those.
No, because you'd be investing in people, and most of these grants are not going to let you, especially the RUS DLT. It's equipment based, not people based. So you're not going to be able to pay for programmers or developers.
And one other note, Kristin, I'm sorry not to interrupt. Somebody was commenting in the chat in regards to pricing. So for we don't know for the RUS DLT grant, but in previous years, it was $500,000 of an award. In the last two rounds, as Kristin and Pat both mentioned, it was $1 million of the award. So in terms of the cost percentage, it is lower. And then for the FCC, we had entities get awards of $1 million, some of them $500,000. You definitely, I'm sure Kristin and Pat saw applications go in that were redlined, as Kristin talked about. So, you might have requested 800,000 and the FCC said, we're going to give you 600,000. We don't think these pieces are things we need to pay for. So just so people sort of understand the percentage of the funding.
Okay. We had also, if anyone wants to stay after, we know that we want to respect everyone's time. You can drop off on the half hour when this was scheduled to be done, but we're probably going to stay on a little bit longer if you'd like. Someone asked, do you know if it's possible to see a complete application from round one, including their budgets? I'm not sure if you're talking about the USDA or the FCC, but I don't know how to get someone's actual application with their budget. I know we all have examples we can talk to someone about, but I don't know if there's a way to see someone's.
Not openly, from what I've seen, some folks would try to go and get it through the Freedom of Information Act, but I wouldn't do that. It don't look kindly upon you trying to do that, to copy somebody's application.
You can see summaries of the executive summary for the U.S. Department of Agriculture RUS grant stuff, but and I think they've released some FCC sort of narratives on winners, but you cannot get their complete application. But one of us can help you understand, possibly show you visually, but we can't give you copies of someone else's work. Okay, so. Let's see. Okay, so someone asked, are the final date for grant submissions different for the different grants? Yes, and I'll add something else to that. We don't know what the date's going to be, but as soon as it hits the street, typically there's 60 days to apply. So the 60-day window. This is why we tend to get really hyped up and say, get ready, get ready, get ready, because you only have 60 days as soon as it hits the street. Start doing your work now. You really need to think through a lot of things. Talk about your workflow, talk about your project team, talk about your goals and objectives, talk about the equipment and technology that you want. What about your telecommunications? Do you have everything you need? Like, there's a long list, and we can help you look through those, but just Just get started now. Don't wait. This money is yours. You all paid into it. Let's go get it back out of it from the taxes that each of us individually paid. In fact, I think there may even be some new programs coming out, like through FCC or USAC. And I always think it's fascinating. Everybody that has a phone bill, if you ever really dig into it, there's that universal service fee that goes into a $4.2 billion bucket every year to give money to K through 12 schools to get their internet access. So we're all paying for all of these programs. Let us help you go get your portion back for your project. Okay, so do you need an assessment or sorry, go ahead. Oh, okay. Do you need an assessment or fit of the organization or project during the 20-minute meeting? Our office hours? No, do we do an assessment or fit? Yes, we will talk about grant readiness and we'll talk about your scope of project. We'll ask you a bunch of questions to see if you are a good fit, and we sort of rule you in or rule you out to help you understand if this is a good thing for you to give level of effort to, because there is a level of effort and time you have to commit to pursuing these. If you're going to get $1 million, it takes some energy to do it. Okay. I just see Summer just put FCC exclamation point. Yes, I agree. FCC. It's applications of public information here. Yeah, we do have the FCC information in the links that I provided that you'll get in the slide deck when that is delivered. The question is, they missed it. Have we worked with a UPL grant? I don't know what that is, so obviously my answer is no. UPL?
I'm not
Bueller?
sure what that is either. I'm sorry.
I don't know what that is. There's a question about the FCC grant. Could a Canadian a healthcare provider investigators be eligible to in any way with conditions for the FCC grant? I don't think so, but I would be looking at NIH and research grants with the NIH. But I would suggest this anonymous attendee come to one of our office hours and we can talk about it more specifically.
Kristin, there's a clarification on UPL upper payment limit. Does that add enough context there?
Upper payment limit,
I don't
yes.
know if you're actually thinking about reimbursement and CPT codes and private payers and Medicare, Medicaid payment, if that's what you're talking about. There have been a ton of updates on that. I have a presentation I was just sending to a bunch of people this morning to talk about the changes in history to now about what has happened to reduce the barriers to deliver telehealth. Some of those barriers were licensure, some of those barriers were reimbursement and payment. So if that's where you're headed, we do have information on that. Yes, I can share that if you contact me directly, Janine. So our contact information, we're going to pop that up here on the screen. In fact, we only have 2 minutes. Do you want to pop that up on the screen, Britt, while we maybe continue answering some questions?
Will do. I'll pop it up so everyone can see it. And
Okay.
Anyone who would like to continue to stay on and ask questions, please do. We're happy to stay, and thank you.
Okay. And Shelley, you have a good question. Do you have any information on stimulus for, or it just disappeared, rural hospitals? Yes, we do. And I can actually give you a lot of information if you contact me. Some of that information is about what each rural hospital is going to get through the formula funds that are coming down. And then the other things I can provide are some either existing or upcoming funding sources, applications, different grants that are dedicated to rural hospitals and rural areas. And there's a fantastic site, which I included in this presentation, you'll get it, to the RHI Hub, Rural Health Information Hub. That group keeps track of all of the funding sources that are coming out. It will have what's been recently released in the last 30 days. It's amazing. So I can give you that. So we just had a question. So I see people doing Q&A and I see them doing chats. So let me go to chat. What percentage of grants are hardware versus software costs? That depends on the grant. I always say that every grant has its own personality, just like people. People are different. Every person is different. Every grant is different, but we can share with you the detail per grant that we're aware of. If that's kind of related to the RUS grant, historically it used to be all hardware, just hardware, hardware, hardware. And it took the industry a long time to convince Washington that software was a part of the puzzle. And they eventually started allowing that. For example, cloud services. It took forever to have Washington understand that cloud services was the innovative way of doing things, and it was current. It's not like it's a new thing that's coming down the pike. This is what everybody's using. So it took some time to get them to approve and make that an eligible cost. But yes, software and hardware percentages vary by the grant. Can telemedicine startups that are generating income qualify? Absolutely. Absolutely. That was from Avtar Singh. Yes, you can apply.
Kristin, there's a couple of questions about whether for-profit entities can apply for FCC money. In the first round, they were ineligible. So they were not eligible to provide, to obtain those monies. And it was a policy reason behind it. They wanted nonprofits to get that money as quickly as possible to be able to see patients. We do not know what the next round will bring, but definitely something we can answer as soon as the application comes out. And I think one other thing, there's a question about what are the drawbacks to actually applying for this money. And I would just say to that, as Kristin said and Pat said, their work. You have to put in work to actually obtain these funds, and you would be working either as a team yourselves or working with a grant writer, but whoever you're working with needs that good information so they can translate it into a narrative for you. So the work you're measuring, as Kristin said, and as Pat said, they'll evaluate you and talk with you about your chances for success. Obviously, as grant writers, we're only as successful as the grants we get for you. So we're very honest about if we feel that you're competitive or not for a certain opportunity. The other drawback is you have to have a plan as to what you want to do with that equipment, and you have to have partners on board. We've seen, I'm sure amongst all of us, a number of grants that go in that have partnerships that aren't fully formulated, and then the grant is received and it's a challenge after the fact, because now the federal government thinks that you're going to be partnering with certain entities. So I think we would just say you want to make sure those partnerships are intact, and all of that is sort of pre-work before the grant goes in.
And whoever asked about the for-profits, while the FCC is unlikely, is unlikely to fund for-profits, the RUS grant does allow for-profits to apply. Oh, do we have
let question and answer continue? But I'm sorry, I have to leave the conference, but I'm grateful for everyone who joined.
Thank you,
Thank you,
Kathleen.
Kathleen.
Thank you so much.
Thanks, Kathleen. Good seeing you. And Kristin, I've got another 5 minutes, Kristin and Britt. I've got another.
Okay. So there's a question in here from an anonymous attendee who says, do we have grants for home healthcare providers? Absolutely. There are grants for that. We can help you find those.
Another one came in here. Do you have any information on stimulus funding for rural hospitals?
I do. I actually had some data up on that. They'll have to contact me directly. I could show them that detail. Veronica asked about the obligation we have for acceptance of the money. I know with the RUS grant, there is an agreement, it's an official agreement, and you have to comply with the terms and conditions. And technically, the equipment is owned by the government until your 3-year term is up, and then you own the equipment and can do with it what you will. So if you have it in rural areas and then the grant is over and you want to put that equipment into the urban places and then do another application to go put some equipment into the rural locations again, you can do that. We know companies that apply for the rural, the RUS grant year after year after year because they expand, expand, expand. It's a fantastic program. And I've seen more involvement with teledentistry. I've seen ophthalmology and eye doctors, more unique, other than sort of the original telestroke or behavioral health or primary care types of standards.
Britt and Kristin, I'm gonna have to drop, and I'm available, like I said, just let me know tomorrow if there's any times, and I'd be happy to answer some more questions for everyone, but thanks again.
Thank you, Pat. Thanks so much. Huge thanks to you, to Kristin, and to Kathleen. And thank you to all of you for joining. This has been fantastic. Really appreciate your sharing all this with us and doing the office hours Friday and Monday. Absolutely. To everyone who's still connected, we'll leave this thank you slide with contact information up for a few more minutes. Go ahead and take down the information. We will follow up by tonight once we can get the recording, with the recording, the slides, the contact information. And thank you so much for joining us. If we can help with anything, any one of us on the contact list, do let us know. Thank you again for joining. Yeah.
Let me thank you for hosting this session, and I highly recommend people go look at your product, look at your website, and thank you very much for hosting this for everyone.
Thank you, Kristin. I appreciate that. Thanks again.
Okay.